Welcome everyone. So in this episode, I wanted to talk about improving participant adherence in research. What kind of factors affect adherence and how it can be improved. And it's clear that participant adherence is a cornerstone of successful research, ensuring consistent data and data collection and meaningful results over time. And I think many times as a researcher, you get surprised how difficult it is to get participants to do simple things. And I think many times as researchers, we think that it's very important data that we get it, but people are busy in their daily life. They have a lot of important things for them, and collecting research data for you is not maybe their priority. And especially if you have small kids and you're working full time, it is easy not to be able to be super organized, remember everything, get everything done all the time. So if we look at the factors that influence adherence, it is comfort of wearing a device if it's a wearable device, ease of use. In the best case scenario, there is nothing participants need to do. If it's like, for example, our Fibion Sense device, a researcher attaches it on the thigh and says, off you go, no need to do anything. Just when it drops out in a couple of weeks, just take it and we will get it back. Or, for example, in case of Fibion Helix, you just ask them to wear it on the wrist, and when it just starts showing red, you just put it in a charger and wear it again. So it is very important that there's no buttons, no apps they need to use, no activation. Even simple things can be too much in many cases. And then it's about also participant engagement. What do they get wearing the device? Do they get important metrics? Do they get something that they really find useful? And choosing then the right device can make all the difference in your study, whether you get an acceptable adherence or not. And if we look at the key strategies, so ensuring the device is unnoticeable and comfortable. And also it's important to consider, for example, if you have a wrist-worn device, does it fit your work clothing? Do your colleagues in the workplace ask like, what's that? What do you have there? Is it unnoticeable? Does it fit the different kind of clothes? Can you wear it in different situations? And that's important to consider. Also with wrist-worn wearables, quite many people tuck their arms under the pillow when they sleep. And if it's a bulky device, it's usually uncomfortable there to have it under the pillow. And people might not then want to wear it during the night. And also, if you, for example, have a thigh-worn device, it should be really thin and it should be easy to attach, and it should be materials that are not irritating the skin. And also if you have a device that, for example, you attach to chest to measure ECG-based heart rate variability or ECG, it's important that the patch that you are using is not irritating the skin. It's not feeling itchy. So those small things can make a big difference. And then it's important to provide feedback for the participants. It can be feedback afterwards, after the measurement, which is often preferred in certain kind of measurements, because you don't want to change their behavior during the measurement if it's not an interventional behavior change study. If it's okay to provide, you can provide real-time feedback, but this usually affects the measurement, and that's maybe not a wished in certain kind of study. But participants should know what feedback they will get, if they wear the device for the desired amount of time. And they should be also informed that when do they need to take it off if it starts to feel itchy, if it starts to feel something. It should be guided for participants. And maybe some examples, like, for example, we have been using a thigh-worn device in the study, and then some participants asking, is it okay if I just put it in my pocket, in my jacket? And it's like, no, it's not really okay. It should be there. And for some people, it might be challenging as they don't know what the device is measuring. They don't know how it works, that they might be wearing it in the wrong place. And this also, even though they are wearing the device or keeping with them, you cannot include that data if it's worn in the wrong place. So giving a good guidelines where the device actually needs to be worn is important. And it for researchers, it might sound like a silly question that can I just put it in my pocket, but that's quite a common question from research participants. And when you actually provide feedback, it's important to provide meaningful metrics that participants find valuable, and they need to be provided in a way that people actually understand them and that they can actually get insights from it. And for example, with our Fibion research and Fibion G2 device, we have put a lot of efforts providing the sedentary behavior and physical activity data in a format that people can actually understand and make changes based on those. And when they make changes, that those changes actually seen in the reports, that they are motivated to make changes when even small changes are visible in the reports. And I think it also comes down to the balance between how meaningful metrics people get compared to what they need to do. So it's nice if they can get meaningful, important metrics without complex protocols. So one example, for example, is Fibion Helix, which the participants just wear it, but it has a very clever way of estimating VO2 max, detecting the rest periods and taking metrics from there, and then taking low intensity activities and looking at the heart rate and heart rate variability and estimating, giving a good estimate of VO2 max. So participants don't need to do anything but wear a wristband, and then they get nice information. And of course, when we are measuring participants, it's very important to prioritize data accuracy and reliability. People are often, for a reason, careful about those things. And it's also important to be able to communicate this to participants. So hopefully I have been able to give few examples, few ideas how to improve adherence. Thanks for listening and have a brilliant day.